Bismillahirrahmanirrahim. These are the important questions that can be asked to you in your exam regarding the development of respiratory system and histology. Question number 1 is: a 45-year-old man underwent bronchoscopy due to the chronic cough. A biopsy of the tissue revealed ciliated pseudo-stratified columnar epithelium, goblet cells, hyaline cartilage, rings, and seromucous glands. Name the structure involved. Obviously, this is trachea. Describe the illustrate and histological features of the structures. You need to draw a diagram or a figure from the Defoe atlas. Okay. First, you have to give the explanation also. Because that will be comprising of the 3 marks. Epithelium will be ciliated pseudostratified columnar epithelium with the goblet cells which are responsible for the mucociliary clearance. Cartilage is C-shaped. Hyaline cartilage rings provide structural support and prevent collapse. Seromucous glands and the submucosa that secrete mucus and serous fluid to moisten and trap particles. Smooth muscle, trachealis muscle, connects the ends of the cartilage posteriorly, allows flexibility during swallowing. Contains lamina propria contains elastic fibers and connective tissue supporting epithelium and glands. In the illustration, you need to point it out: the inner layer, the middle layer, and the outer layer. Outer layer will be having C-shaped hyaline cartilage ring with posterior trachealis muscle. Middle layer with the submucosa and submucosa with seromucous glands. Inner layer with the epithelium, ciliated pseudostratified columnar epithelium with the goblet cells. Question number 2 is: a young boy fell from a height and complained of difficulty in breathing. Radiological examination showed fractures of the third, fourth rib on the left side with splinters penetrating the left lung. Air was detected in the pleural cavity. Which condition is compromising the breathing? In this case, name the membranes lining the involved cavity. Enumerate the parts of the outer layer of the cavity and the nerve supply. It is pneumothorax, air in the pleural cavity, which causing the lung collapse. That is question number 2b is: name the membranes involving are will be the pleural membrane, visual pleura, and the parietal pleura. Visual pleura covers the surface of the lung. Parietal pleura lines the inner surface of the thoracic wall, diaphragm, and mediastinum. Question number 2c is: parts of the parietal pleura and the nerve supply. Costal pleura lines the inner surface of the ribs and intercostal spaces supplied by the intercostal nerves. Mediastinal pleura covers the lateral aspect of the mediastinum supplied by the phrenic nerve. Diaphragmatic pleura covers the superior surface of the diaphragm supplied by the phrenic nerve. Cervical pleura extends into the neck supplied by the intercostal nerves. Question number 3. A 30-year-old woman presents with a persistent cough and wheezing. A biopsy of her airways reveals ciliated pseudostratified columnar epithelium, smooth muscles, bundles, and cartilage plates. Name the airway structure involved. Name the histological feature of this structure. This is the secondary bronchus or the lobar bronchus. Histological features include: epithelium will be ciliated pseudostratified columnar epithelium with the goblet cells. Cartilage will be irregular with cartilage plates. Smooth muscles surround the cartilage and mucosa to control airway diameter. Submucosa contains seromucous glands. Lamina propria with elastic fibers and connective tissue. Question number 4 is: a 12-year-old boy fell from a bicycle and presents with difficulty breathing and chest pain. X-ray shows air and the fluid in the pleural cavity on the right side. What is the most likely condition? Name the membranes lining this cavity. List the part of the outer layer with the nerve supply. It is pneumothorax because there is blood. Okay, this is pneumothorax, air and fluid. Fluid means represents the blood. The membranes will be pleural membranes, visual pleura and parietal pleura. Parietal pleura and visual pleura. Nerve supply we have already discussed. Costal by the intercostal nerve, diaphragmatic by the phrenic nerve, mediastinal by the phrenic nerve, cervical by the intercostal nerve. Question number 5 is: a 2-year-old child presents with the stridor and respiratory distress. Imaging reveals a defective cartilage formation in the larynx, which structure is most likely malformed. Explain the embryological origin of the affected structure. It is laryngeal cartilages. They are derived from the 4th and 6th pharyngeal arches. Embryological origin is neural crest cells contribute to cartilage formation. Malformation leads to congenital laryngeal stridor. Question number 6 is: a 6-year-old boy presents with the persistent drooling and regurgitation of the milk. Maternal history or reveals polyhydramnios Imaging shows a connection between trachea and esophagus near the most likely embryological defect explain the normal development of the involved structure. This is tracheoesophageal fistula, which is usually asked in the viva and from the OSPE point of view and a SAQ point of view. It is very important. Normal development is when the tracheoesophageal folds grow, they fuse in the midline, they separate the foregut into the esophagus posteriorly and laryngotracheal diverticulum anteriorly. Failure of the fusion results in the fistula. Question number 7. A 45-year-old man presents with chest trauma after a car accident. Imaging shows fracture of the ribs 5th and 6th with fragment penetrating the lung and air in the pleural cavity, which condition is compromising respiration. Pneumothorax lays the membranes, visual and parietal pleura. Parietal pleura contains costal by the intercostal nerves, diaphragmatic and mediastinal by phrenic nerves, cervical by intercostal nerves. A 36-year-old woman develops shortness of the breath followed by the abdominal surgery. Imaging shows elevation of the right hemidiaphragm. Which nerve is most likely injured? Explain the normal function of this nerve in the respiration. Answer is right phrenic nerve. The right phrenic nerve innervates the diaphragm, providing motor fibers for contraction during inspiration and sensory fibers for central tendon and diaphragmatic pleura. Injury leads to paralysis of the ipsilateral diaphragm, reducing the lung expansion.